Bartholin glands are two small, pea-sized glands located on either side of the vaginal opening. Their primary function is to secrete fluid that lubricates the vaginal area. When the duct of one of these glands becomes blocked, fluid can accumulate, leading to the formation of a Bartholin cyst. If this cyst becomes infected, it can develop into a Bartholin gland abscess. The most common cause of a Bartholin gland abscess is a bacterial infection. The infection may arise from bacteria that enter the vaginal or urethral area. These include organisms such as Escherichia coli, Staphylococcus aureus, Neisseria gonorrhoeae, and Chlamydia trachomatis. Anaerobic bacteria and polymicrobial infections are also frequently involved. Risk factors include poor hygiene, frequent sexual activity, trauma to the area, and a history of previous cysts or abscesses. A Bartholin gland abscess usually presents with a painful swelling near the vaginal opening, often on one side, redness, tenderness, and a feeling of warmth over the area, difficulty walking, sitting, or having sexual intercourse. In some cases, fever and general discomfort. If the abscess ruptures, there may be sudden discharge of pus and relief from pain. Diagnosis is mainly clinical, based on the patient's symptoms and a physical examination. During the exam, the doctor may find a tender, fluctuant mass on the posterior part of the labia majora. Swabs of the discharge may be taken for culture, especially if an STI is suspected. Additional tests, such as urine analysis or screening for gonorrhea and chlamydia, may be done. Imaging, like ultrasound or MRI, is rarely needed, except in unclear cases or in women over the age of 40, to rule out cancer. Treatment depends on the severity of the abscess and whether it is a first-time occurrence or a recurrence. For small, non-infected cysts, conservative management may include warm sitz baths and pain relievers. However, for abscesses, incision and drainage is the treatment of choice. A small cut is made to release the pus, and a word catheter may be placed to keep the duct open and prevent recurrence. In cases of recurrent abscesses, a surgical procedure known as marsupialization may be done. This involves stitching the edges of the cyst wall to form a permanent drainage opening. Antibiotics are prescribed if there are signs of systemic infection, if the patient is immunocompromised, or if an STI is suspected. Common regimens include amoxicillin with clavulanic acid plus metronidazole or ceftriaxone combined with azithromycin or doxycycline. For patients with repeated abscesses that do not respond to other treatments, surgical removal of the Bartholin gland may be considered, especially in women over 40, where there is a small risk of glandular cancer. If untreated, a Bartholin gland abscess can lead to recurrent infections, chronic cyst formation, scarring, or even sepsis in rare cases. Fistula formation or cellulitis may also occur. Importantly, although extremely rare, Bartholin gland carcinoma should be considered in older patients with recurrent or persistent symptoms. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.